I'm Reese. I'm a physio, sports injuries and general MSK staff. I wanted to come to the course because I found the hip and groin a complicated area for me to assess personally. Found that there's lots of different things that I maybe categorize, as we've gone through on the course, categorize into sort of boxes rather than being a little bit more specific. So I wanted to come for more clarity on diagnosis, and then also some good ideas for rehab, because I suppose my strength maybe is more manual therapy based and less exercise rehab based.
Yeah. So we've gone through a lot of stuff. So there must be a few things which sort of stood out for you over the time. So what are the things you find clinically useful so far?
Definitely differential diagnosis. Some of the more rare things, that potentially things like Terry's tear and stuff, which I would never have even considered really. Just variation on rehab. I thought the rehab exercises are great because I often get stuck with pretty basic, boring stuff, and then it's nice to have a big pool of things you can go back to. I think I'll be a lot more. I'll review it after the course, obviously, practice, and then I think it'll be a lot more clear with my diagnosis. And obviously, once you've got a good diagnosis, it's much easier to then inform your treatment plan. So.
And once you have a good understanding, improve the outcomes.
Of course.
One on that. So for somebody, we come in next year, somebody who's possibly looking at joining, attending our course in Dubai next year, what would you say to them?
It's definitely worth it. 2 days is a lot of information, but a lot of stuff you can use, which I think this is one of the strengths of this course I've found, is that you can go to clinic tomorrow at work and you can use some of these exercises straight away with patients I can think of, whereas other courses sometimes potentially maybe you don't get the practical application.
Yeah. So. And do you think a lot of material used can be applied to patients straight away?
Yeah, and I think there's a lot of pain. I can just think of patients now that maybe I've dismissed as back pain, for example, who actually maybe if we have a bit of a closer look tomorrow, potentially might be finding something different.
I've been having a lot of hip patients, and I realized that my scope of treatment was kind of limited. Okay. Like I knew there was a lot of stuff that I could do, but it was not giving me the results I was seeing with my other knee patients or my shoulder patients. So when Anil spoke to me about this course, and I've heard a few of your podcasts, I was like, okay, I need to come attend this course and kind of streamline what I'm doing so I can get better results with my patients.
Yeah, and obviously we still not completed the full course. We've gone through quite a material. What sort of things you found useful which you might apply with your patients in the future?
So the kind of distraction techniques for patients to do at home, because we've been having a lot of dependency issues where patients are really afraid to let go of a physio kind of hands-on approach. So something like that, and things that they can do, building up their confidence about little things that they would like to go back to sport but cannot. So a few things about guiding them, and a lot of your exercises are actually spot on what I can see with what I would like to give my patients. And because all of them want to go back to sport, each and single one of them. So I think this course with your exercise program is actually like addressing that issue.
So do you think confidence going back?
Kind of. Like I know there's a lot of things I would like to do on my patients right now, and
try.
Definitely.
So we're coming back next year, and for therapists who possibly looking at doing an event next year, what would you say to them?
Do the course. You must attend the course, and if you want to increase your knowledge or increase your capability as a physio of working very effectively on hip patients, hip and groin patients, this is the course for you.
Thank you, Seema. Thanks for
at Osteopathic Health Centre. Obviously, I'm a physio, but I do quite a lot of hip work there. Max Feherly, who's an orthopaedic surgeon, is quite closely associated with the clinic, so he sends quite a lot of hip patients to us afterwards for rehab. So I do quite a lot of hydrotherapy. But being honest, my hip knowledge wasn't what I feel it should have been. Obviously, I've been following Ben on Twitter, and with all this FAI stuff coming to the front, which didn't really exist when I trained, I'll be honest, I don't think. I just thought I just needed to really update my knowledge on hips. So, a two-tier prong. One, I wanted to, know a bit more about the OA and rehab following the hip replacement from which I I'm quite happy with, but all the FAI CAM stuff and pinch lesions and all that stuff.
So all the FAI and CAM stuff,
Yeah.
are you more comfortable with
I'm
that now?
very happy with it now, yes. I mean, I'd read it through a textbook, but it's nothing like actually going on the course and going, reading all the research papers that you guys gave us and then going through it practically as well.
Do you think you'll be better equipped now dealing with those kind of patients in clinic?
Definitely, yeah. I feel a lot more. I think, you say, the groin is a little bit of an enigma because there's so many things that can cause pain there. That when patients come in, you sort of think, oh God, is it the hip? Is it soft tissue? Is it a sports hernia? Is it the back? Is it SI? And I feel a lot happier now to actually assess and be a lot more thorough with my assessments and know exactly what I'm looking for.
Brilliant. And
so,
if people were in Dubai and thinking of coming on a course,
definitely,
you'd recommend the
definitely,
hip? Fantastic.
Yeah, definitely. I mean, I do a lot of Pilates, so a lot of the rehab stuff I quite like doing, but it's just good to think, that's a really good exercise. It's always good to go on courses and learn new exercises again, which I've learned a few good ones to add to the list, which is great.
Would you say that you've got some new exercises and some new treatment techniques that you could start with tomorrow?
Always good to go over the NWMs again. It's a few years ago since I did my mulligans, so it's good to think, I forgot that technique. So yeah, it's just good to be updated.
Brilliant, thank you very much.
And learn all the new stuff, of course, as well. So
fantastic.
Thank you for a great course.
In a private setting, I see a lot of cases ranging from elite athletes, recreational athletes, age population, sedentary lifestyle background people, kids also.
So real mix.
It's such a real mix that you never feel like you know it all.
Yeah.
So you can never be that snobbish to think that you're prepared.
Yeah, okay.
So what I enjoyed so far was the specificity of the information that we received, the fact that it covered most of my interests. So I would say, seeing your description, two things that jumped to my attention were diagnostics and clinical reasoning. I think this last one is the biggest one, because if you're not sure what you're dealing with, your outcomes will be poor.
Oh, yeah. So it's having that sort of broad view of all the different pathologies. Yeah?
Absolutely.
Okay. And do you find it is practical for you to use? What are the things you think you'll be using some of the material in your work? Sort of some of the techniques and exercises.
I find it so highly prepped that I want to use everything and anything. The amount of information is so high that it felt overwhelming actually. It's a beautiful thing knowing that the information will be available there post-course and that you can actually focus through it and absorb as much as you can while you're there.
So do you think it's going to influence the way you treat patients in the future, hip and groin?
Well, absolutely. I already have in mind a few things that I'm going to do in my clinical practice starting tomorrow itself.
Okay, excellent. So last thing is, if somebody, you're coming back in Dubai next year, somebody who's interested in this course, doing next year, what would you say to them? They're looking at a prospect and they're looking whether to go or not. What would you say to them? If
you want to be up to date with your hip pathologies and treatment strategies, that's the place to be in. Definitely that's the place to be in. You can never know it all. You can never be that snobbish to think that, come on, it's not up to my level.
Yeah. So getting up to date of the current.
Absolutely. If you want to be on top of your game, it's a must.
Okay. Thank you.